The alarming prediction from the Biden administration, they're now saying as many as 100 million Americans could become newly infected with COVID in the coming months, and that the U.S. must be prepared for a surge, pleading with Congress to prepare as well with a significant increase in funding. Dr. Jha, the White House COVID response coordinator, is here tonight, and we ask him what's driving this prediction. The administration acknowledging that this prediction, this possibility, means people who've had COVID before could get it again. They say the funding is needed for testing and treatment and to prepare. It comes as the Omicron subvariant spreads, cases rising nationwide, hospital admissions up in at least 37 states already. In New York City tonight, transmission up nearly 33% in just 10 days. And the mayor tonight here saying a return to masks may be on the table. And the other major concern tonight that the CD is also watching is this rise in cases of a rare but severe hepatitis in children. More than 100 children in at least 25 states and territories. 5 deaths. Some have had liver transplants. Of course, the question, is this COVID related or is there another virus driving this? We asked Dr. Jha about that as well. But first, this warning about COVID and the Biden administration saying Americans and Congress should be prepared. ABC's Whit Johnson leading us off tonight.
Tonight, the new dire prediction from the Biden administration. As many as 100 million newly infected Americans with COVID in a fall and winter surge, up to 30% of the U.S. population. That from a senior administration official calling this one of many scenarios based on modeling, which doesn't account for the potential of a new major variant. This comes as the White House unleashes a full-court press on Congress to pass more than $22 billion in COVID relief funding, warning what's at stake if lawmakers remain gridlocked.
The consequences here are quite catastrophic if we do not get funding. I mean, my goodness, we're not going to have vaccines for the American people. We're going to run out of treatments for the American people. We're not going to have diagnostic testing. It's a pretty bad situation.
Officials also bracing for a COVID resurgence this summer. At least 37 states already seeing an increase in hospital admissions. In New York City, transmission up nearly 33% in 10 days. The city's mayor now suggesting a return to mask and vaccine mandates is on the table.
If we switch to the next level, then we would take those actions based on that, but we're not there yet.
All this as the CDC investigates another major health concern, an alarming increase in cases of rare but severe hepatitis or liver inflammation in children. More than 100 children infected in at least 25 states and territories over the past 7 months, and officials now revealing at least 5 deaths. Health experts looking at COVID among a range of potential viruses and other causes that could be driving the increase.
The children affected are young, with a median age of 2 years, which means that most are not eligible to receive the COVID-19 vaccine. COVID-19 vaccination is not the cause of these illnesses.
The CDC exploring all possibilities, but saying a leading theory is whether adenovirus could be a factor, citing a cluster of 9 cases in Alabama in which children with hepatitis were also confirmed to have adenovirus. Adenoviruses are a different type of virus from coronaviruses like COVID. Both can cause respiratory illness. Officials saying more than 90% of the hepatitis cases in the U.S. resulted in hospitalization, 14% of children receiving liver transplants. Tonight, doctors stressing these cases are extremely rare, but urging parents to be on the lookout for key symptoms.
Parents should not panic. This is still incredibly rare. Just be on the lookout for nausea, vomiting, diarrhea, abdominal pain, maybe yellowing of the skin.
So let's bring in Whit Johnson with us tonight on these 2 separate health headlines. This prediction first that 100 million Americans could be infected in a fall surge in the months ahead, obviously with the Omicron subvariant sweeping the country already. And then the second headline that you reported on, this rare hepatitis in children. And Whit, so far, authorities say these children aren't coming to the hospital with COVID, but scientists I know are now looking at their blood to test it to see if they had a past infection of COVID.
Yeah, David, they're looking at those blood samples, testing for antibodies to see if there are any signs of a past COVID infection to determine a potential cause there. But again, they're looking at a variety of potential causes and viruses, including that adenovirus. And it's not just children here in the U.S. Health officials around the world are tracking similar outbreaks. David.
All right, Whit Johnson leading us off here with thank you. We know many of you have questions at home about this new prediction, this potential for 100 million new COVID cases, and this alarming news on a rare but obviously serious hepatitis affecting more than 100 children. Dr. Jha in his White House role joining us just before we came on tonight. Dr. Jha, the White House COVID response coordinator, back with us tonight. Dr. Jha, thanks for joining us on these two major health headlines tonight. First, we heard you there, your plea today for more money from Congress with this warning that got our attention. As many as 100 million Americans, you're predicting, could get COVID in the coming months, this fall, a new surge predicted, including people who might have had it before. I'm curious what's driving this forecast. The Omicron subvariants we're already seeing sweep the nation, or variants you're seeing elsewhere around the world. Why are you so concerned, and why are you predicting these numbers?
Good evening, David. Thanks for having me here. You know, each of the last two winters, we have seen a large surge of infections. With waning immunity, with Omicron as contagious as it is, and each new version becoming more contagious, I think it stands to reason that we may very well get a large surge of infections. That's what a lot of outside experts are saying. And so right now we are doing everything we can to prepare for that, to make sure Americans are protected and ready if that surge were to come.
Do we have to be prepared for the Omicron subvariants that we haven't even seen in this country? For example, the subvariants we're seeing in South Africa already?
Yeah, what we've seen throughout the pandemic is that we see subvariants and variants arise in other countries, arrive here. Sometimes they arise here as well. I think between now and the fall and winter, very possible we're going to see new variants and subvariants, and we have to be ready for them.
I know many Americans are exhausted just to hear these numbers, this new prediction. I'm sure you're exhausted on many levels as well. For people watching tonight who've been vaccinated and boosted, or who have had COVID before, how much immunity do they have? Should they be prepared to get COVID again? Because we all know folks who've had COVID who are now getting it again.
Yeah, so I think if you've been vaccinated and boosted, you have a very high degree of protection against severe illness. That's sort of point number one. So for people out there who have not gotten that vaccine or have not gotten boosted, absolutely critical that you do that. We don't think that prior infection alone is going to be adequate protection as we go into the summer months and as we go into the fall and winter. So vaccines remain a cornerstone of protecting people as we move forward.
But a good chance you could get it more than once here.
Absolutely. We've seen that over and over again.
Let me ask you, Dr. Jha, about these hepatitis cases in children. Obviously very alarming for parents, really everyone watching this. Many of these children were obviously too young for the vaccine. That means this is not vaccine related. I know that's out of the picture here. What's not known is whether these children had been infected with COVID before. But I know while you're looking at their blood and looking for the antibodies to get the answer to that question, you do know about a different virus that's already been connected to many of these cases.
That's right, David. We've seen that there's a form of adenovirus, a very common virus that kids and adults can get, but has been found in high numbers in many of these kids. We don't know if that virus is causing it. We don't know if there's an interaction with a prior COVID infection. A lot more to sort out here, but obviously we're looking at this very closely.
Bottom line tonight for parents watching, what should they look for?
Well, what I would say to parents is obviously if your child develops health problems, going to seeing their pediatrician or their provider early is important. What we also know is that the vaccines, as they become available, are incredibly safe and effective at protecting children moving forward. We don't know if COVID is connected to these hepatitis cases, but what we do know is COVID can still cause serious problems in kids, and the COVID vaccines are incredibly effective at preventing serious illness. But we will see what the data shows, I think, in the upcoming weeks.
And we'll be looking forward to that data. Dr. Jha, White House COVID response coordinator tonight. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.